that kind of reminder for me where I started 12 years ago running and what you can accomplish when you set your mind to it.
Yeah, I love that spot because, most of the people we train do the 15K.
Yeah.
And to be able to see them twice on the course when they come around the first time and then as they go down the hill to the finish line, it's pretty exciting. And it's great to see how everybody does and, find out how they do and whether there's some improvement, whether they reach their goals.
And you see all these runners that you've been training.
Yeah.
And they run by and you're like, it's got to be an awesome feeling.
Oh, it's great. I feel bad when I miss them.
I know.
Too. They're coming up out of the lagoon and you're hoping they're slowing down enough on that little bit of a hill that you can recognize faces, but with hats on and, sunglasses, sweaty, tired.
I know.
Kind of those anguished looks. You're kind of hoping that you recognize and can say hi to everybody.
Yeah, so I'm just really honored, Blair, that you're with us today on Healthy You. You've kind of been a mentor to me in the running world. And I know in your career we have some similar interests.
Yes.
And so we just want to welcome our viewers. Hey there out there, Facebook world. And maybe you're viewing on cable TV or on the website. We want to welcome everyone. We are live here on Peoria Life, Healthy You. I'm Kim Martin, host of your show. And each week, I just want to share information with you that's going to help you live a healthy lifestyle. It is a journey. There's so much to learn about living a healthy lifestyle and what that means. So just want to give you information, motivation, encouragement, and really educate you in what it truly means to be healthy, a healthy you. So I am excited. I'm talking to my guest today, Blair Gorsuch. He is an exercise physiologist. He works for OSF as a supervisor in the employee wellness program. And he was also my running coach when I started my running career 12 years ago, which is what we were just talking about. So he's got lots of experience to share with us, but we are going to be talking about a topic that women definitely don't have to worry about this one, but it is something that men need to be concerned about, and especially our loved ones, our partners and husbands and dads. And so this is just a great show. Blair, you're going to share your story with us, and we're talking about prostate cancer. But just first of all, what the heck is an exercise physiologist? Maybe some of our viewers are thinking, what is an exercise physiologist? Help us understand what you do.
Okay, first of all, thanks for having me. My mom always wondered that when I came out of grad school, what are you going to be doing with that degree? But I came out of school with a pre-med major. Wasn't sure what I wanted to do with it. Was thinking about medical school. But I had a love of swimming. I swam all my life, swam through college. It kind of helped get me through school. And I ended up in a YMCA coaching a swimming program.
Oh, okay.
And as I worked with athletes, I realized that there's more than just putting a workout together. You needed to be able to understand the athletes individually, their physiology, their biomechanics, how they functioned. Everybody responded differently to different training methods.
Right.
And just out of natural curiosity, I decided to start trying to learn a little bit more. And there happened to be, I was up around the Chicago area at the time, there was a small school up there that was actually affiliated with the YMCA, and they were offering a program in exercise physiology. And the only two programs at the time were there and at the University of Wisconsin and La Crosse. I mean, that's about how long it was. And so I started taking classes, in cardiac physiology, muscle physiology, biomechanics, kinesiology, statistics, even behavioral issues, statistics. And it came out of the program still coaching swimming, but able to, use more information to get the athletes to where they needed to be. And so I stayed there for a while, and then I was actually offered a position at Yale University and went out there and was working in a human performance laboratory where I was working with athletes, again, testing, analyzing, training.
Like the motion of the body, how the muscle works and how it responds.
Right. And trying to make the athlete more efficient.
Okay.
Faster, better, stronger. We also use the information if an athlete were to get hurt to try and work with them to get them back to that level they were at before, and really try and analyze what the root cause of the problem was so that we could better tailor the training program to what they needed. It was a great experience because there were over 32 varsity sports at Yale, women, men, things like, lacrosse, field hockey, gymnastics, fencing that you don't normally deal with in the Midwest.
Right.
Programs that are growing. And then I came back to the Midwest. There was a position open in cardiac rehab and pulmonary rehab with Proctor and Methodist, and started that program. And so I kind of went from the well-being to the kind of secondary prevention, people who've had issues and trying to get back on their feet, but still use that knowledge that I got in the exercise physiology program I was at to individualize the programs, get the people back to where they needed to be, more about quality of life.
That's right.
Reducing reoccurrence of problems on down the road. So I was there for quite some time, and that's when I started the training program with Illinois Valley Striders. And, we did building steam, team steam. That's where we met.
That's where we met.
Still coaching in a different facet with that, with the training program that's still affiliated with the Striders and Running Central. So I've still been able to do that and do some individual coaching. And, along the journey, been able to continue myself with some running, triathlons, some cycling, swimming. But got sidelined a little bit in 2009 when I was diagnosed with prostate cancer. So it was, being healthy, fit all your life, and then all of a sudden,
that's a blow. I can't imagine.
Facing that. Anybody who's facing that cancer diagnosis, it really kind of changes your life, whatever it is, and to whatever degree it is. And for me, it was a change, and it still, almost 10 years later, every time you go in for that PSA test, that screen that follows up to make sure that you're where you're at and things are still going good, it brings it back like, okay, what if that level is high? What if that scan shows that I need further treatment? And so you live with it, and you deal with it. And for me, the big change with the prostate cancer was not only dealing with the cancer, but my activity and exercise changed so much as a result of that, more than I ever anticipated.
So you had to take it down a notch.
Yes.
Okay, yeah. But we're going to talk about that a little bit and help people understand things that they can do. It's not with the way we are in care for cancer in this day and age. We were talking before we started recording about breast cancer, kind of that statistic being like 1 in 3. And with prostate cancer, you said you weren't 100% sure where that was as far as statistics, but it's pretty high. I mean, there are a lot of men being diagnosed with prostate cancer. It's kind of like prostate cancer to men is kind of like breast cancer to women, right? They kind of compare.
And the risk is increased if you have a family history. I'm the first in my family that had that history of prostate cancer, so my sons, need to be aware and concerned that screen. Most screening for prostate cancer doesn't start in men until after the age of 40. I was extremely fortunate in that the field that I was in, I was very interested in preventive medicine. So I took advantage of Prostate Awareness Month every October and took advantage of the free screenings. And went in on a regular basis and had that done on a yearly basis, and that's how it was caught. There's some pros and cons as to when that screening should start, the validity too. In my case, it was very beneficial in that it caught it, and it caught it early, so it was able to be treated. Yeah.
Same. So just like with breast cancer, prostate cancer, the earlier it's caught, the more curable it is.
Oh, definitely.
What's the cure rate? I mean, is there like different stages, kind of?
There's different stages, kind of like with breast cancer, in terms of where they catch it. When they do the testing, they do a biopsy to look at how much of the prostate's affected by the cancer, and then they put it together into what they call a Gleason score. And the Gleason score is your relative risk. So the higher that score, there's a very low risk where they may just say, well, let's just watch and wait, because certain prostate cancers are very slow growing. Then they have like a medium risk where you kind of have to say, okay, look at your age and some other risk factors, probably growing a little bit faster, how long until you would have to treat. Again, another option is watching and waiting, but on the other hand, you're given about 5 different other options that you can take advantage of, and it's kind of left up to the individual to determine which is the best method of treatment. And then there's a score like kind of beyond which, you definitely do need some treatment, whether it be radiation, chemo, maybe removal, hormone therapy for that and so forth. So for me, I was in that medium range.
Okay.
The thing that was interesting for me is my PSA score wasn't abnormally high. And how it was detected is the doctor who was looking at the scores went back and looked at the 10 years I had done before and said, your PSA level doubled from what it was. It wasn't even in the
But you were so healthy that anything increasing would have been a kind of a red flag.
Right. And so they went in and did a biopsy.
Okay.
Didn't find it. So he thought that maybe it's an infection that, they'll treat with antibiotics. So they went 30 days and actually did my PSA level, and it dropped a little bit. But the urologist who I was working with wasn't satisfied. He said, I don't think that it's an infection. I think you've got something more going on. And he said, let's wait for a month or two and re-examine the PSA and bring you back. And it crept up again, and he did another biopsy and caught it on the second biopsy.
Found it. So it was just so early on.
Right.
Yeah,
right.
And that preventative care is huge.
Oh, it's huge.
It's huge. So you recommend men after the age of 40 is generally when they start doing these annual exams, and I'm sure there's some guys going, I'm healthy, I don't need to do the preventative care. Well, what can they expect? What's the expectation going through these preventative care methods? I know, we do mammograms for women.
Yeah, and I look at, I grew up with sisters, wife, daughter, going through the mammograms, right. And I know it's uncomfortable and the pelvic screens are uncomfortable. Guys, just get it done. The PSA is a blood test. The digital exam is a rectal exam. It is uncomfortable,
right.
But it's livable. You get through
necessary.
it.
You survive.
Yeah,
real men get their PSA.
Yeah, doesn't take all that time. And like I said, for Race for the Cure, Komen, Breast Cancer Awareness Month, Buddy Check 25. For men, October is Prostate Awareness Month. All of the urology groups in Peoria offer free screens. Just get it done. It takes 10 minutes out of your day.
So go along, do it together.
Yeah.
Maybe you plan it together. What a great collaboration, really,
right.
For men and women to kind of say, all right, it's October. It's time for our checkups, right? And there's I know the Methodist Wellmobile or the screenings are out all over in October doing checkups
right.
for breast cancer awareness. You get free screenings everywhere. And the urology group, you said?
Yeah, all of the urology groups in towns in October do free screens.
Free screenings.
It's usually done in the evenings throughout the month. So it's, you can't not take advantage of that. I think, men, if you're over 40 and you have a family history, you definitely should get it done.
Yes.
If you're over 40 and don't have a family history, I'd go with the recommendation with your physician. But, definitely it's something that should be a part. If you're doing an annual screen, just like the ladies, you should probably be going in and having that done. It's so simple.
Just do it. And find it early. Now, okay, help us understand if it was found in early stages. So, and you said yours kind of the midline. So what kind of treatment did you have to go through?
Well, this was before, navigation is a big word in healthcare now. You get navigators for different systems that kind of help you funnel through the system and find the best method of treatment. When I was diagnosed, I was kind of given 5 different phone numbers and say, here are your options, call these 5 numbers and see what you want to do. And, I went everywhere from an oncologist to a family physician to look at different methods. They had radiology, they had what they called proton therapy, which was experimental back. And those days, there's only 5 centers in the country that were doing that. They had, of course, chemo, which really found out later wasn't a viable option for me. Hormone therapy, which was another. And the radiation therapy, there's different types of radiation therapy that you can have. There's treatments that are done over 45 sessions. There's a treatment where they actually insert radioactive rods into the prostate,
right.
And it's done overnight. You're in and out, and it's kind of a one and done thing. So there were a lot of different options facing me, and I was looking at OSF and talked with the radiation oncologist there, and he was suggesting this new trial therapy, this proton therapy. So I called a local friend that I knew who was a radiologist who had come out of Indiana where they had one of these centers. And he gave me the name of the physician who was the director, but he had moved to Jacksonville, Florida. So when I actually called him and got his number and was talking to the physician personally and was pretty impressed with that. And so we were talking and he said, well, where are you from? And I said, Peoria. And he mentioned the physician that I was seeing and he said, oh, you got the best doctor, the best facilities in the Midwest.
That's awesome.
He said, you can come here if you would like to do it. He said, it's 45 treatments. We're seeing the same results as we are seeing with radiation. But he said, if you're in Peoria, I would recommend you staying where you're at and having it done with this doctor. And then he turned around to the other end and said, but if you decide to come to Jacksonville, Florida, you can stay with me for the 45 days.
Oh, nice.
Jacksonville, Florida, Peoria, a little bit.
Right.
But it wasn't winter time, so it wasn't that much of a choice. But so I did the radiation treatment. I had 45 treatments, and I did it. Continued to work. I didn't take any time off. Continued to train and exercise, and I know we're going to talk a little bit about that. But I realized that it wasn't just the radiation and going in for the treatments. Of course, there's a lot of other issues that go on, and anybody who's facing any kind of a serious illness, mentally, physically, and how you react to certain things.
Emotionally too, right?
Emotionally, yeah. And I'm a competitor like you. I'm a fighter, and when they gave me the option of sitting there and watching and waiting this disease or fighting it, it's like, let's get it done.
Let's get it out of here.
And fight this thing. And, the watching and waiting odds they gave me, they said, well, it's only going to be 3 years until you have to treat it anyway. And I said, so why wait?
Why wait? Get it done now. That's a good thing. Hey, if you are just tuning in and you kind of just ran across our show, you are watching Healthy You. I'm Kim Martin, host of your show. And every week on Wednesday morning, we just want to share information to help you live a healthier lifestyle. And today I'm talking to Blair Gorsuch. He works for OSF. He is a supervisor of their employee wellness, but he's also an exercise physiologist and a prostate cancer survivor. And so we are just sharing some of his experience with you. If you or someone you know is faced with prostate cancer, or you have a husband that he's at that age where he needs to go get checked, have them watch this show, like and share this show, okay, so that they can hear Blair and be encouraged and inspired to take care of themselves and do some preventative care. And that's amazing, Blair. I'm so excited that you're sharing this story. So many people, we get embarrassed, or we just think maybe we feel weak that we got sick or something like that. So it's hard to share to the world your story. And so I think it's awesome that you're willing to share and encourage others with it. So being an athlete as you are, what happened with your exercise? You said you had to take it down a notch, but can people still exercise? Can men still exercise once they've been diagnosed with prostate cancer? I mean, what's the prognosis as you're going through treatment?
To get back to one issue that you just brought up about sharing the experience, one of the things, I have a cousin out in California at the University of San Diego, and she was head of the cancer program out there. And I was having a huge problem when I was diagnosed telling people. Because I didn't want people to know I was weak. I didn't want them to know I was sick. I didn't want them to know what this was going on. And she told me at that time, she said, for every person you tell you have cancer, this is for any cancer patient, you can affect 7 lives.
Oh, wow. It's like the ripple effect.
It's a ripple
the butterfly effect.
And not just saying, my own story is there's people, men, that I've talked to and shared my experience with, who have gone in and had found prostate cancer as a result, never had an exam done, never had a PSA done, was starting to have some men issues like, frequent urination and things like that, didn't know what was going on. And this was some of the things that I was having. And went and had a check and had a diagnosis done just because I had said something to him about my instance. So sharing is a big thing, I think, because it makes people more aware that it is something that you need to be aware of. I mean, it's, and
it can happen to anybody. And a healthy person, you can be, obviously, this is Healthy You. We want to encourage people to live healthy. It reduces your risk. I mean, the American Cancer Society put out, if you keep your body fat in a healthy range for your age and you exercise and eat well, you reduce your risk of cancer by like 40%.
Yeah.
So by living healthy, you do reduce your risk, but it's no guarantee.
That's huge.
Obviously.
Yeah, that's huge. That's huge. But as far as the exercise, in 2009 when I was diagnosed, I wasn't competing anymore. I had done marathons, I'd done half marathons, and I was racing a lot. And I'd kind of wound down doing more coaching and enjoying that, kind of living my life through my athletes, I guess. That. But I was still a big, yeah, but I was still a big exerciser. But it was, for me at that point in time, the competition wasn't as important. It was more about quality of life, staying healthy, and being active with my kids and my grandkids, and just being able to have that quality of life from day to day. But I was still training like an athlete. I was still putting the hours in during the week, and 14, 16 hours a week, and I was still cycling, biking, and swimming. And when I asked the physician about this, he said, well, with radiation, what you're having done, you still should be able to continue to exercise. He said, it'll be like you've been in the sun for a while. You'll feel that kind of fatigue and tiredness, but you'll be okay. You should be able to do this. Now, if I had surgery, if I had my prostate removed, I'm sure there would have been a recovery period of time from the surgery until I would be able to get back to doing it. Chemo, same way. It may have weakened your system a little bit more, so it really probably would have taken me down even more of a notch, if I would have had that done too. But with the radiation, I was able to just continue on with it. But it did slow me down. And, I think we talked about the emotional side of it, and I think maybe there might have been some depression there. But I just found that I couldn't do what I did before. I mean, I slowed down. I had more fatigue. I would do my treatment at the end of the workday at about 4:30. I'd have to go home and take a nap before dinner, and I had to get up, eat dinner, go back to bed. And I'm a morning exercise person. I like the 5:30, 6 o'clock, getting harder to get up, getting harder to get the workouts in. So I went and talked to the physician. I said, I thought you said it was just going to be just like a little bit of fatigue. And I don't think he realized the level that I was exercising at that point in time.
Well, most people probably aren't exercising at that level.
Yeah.
Especially, at that age too, right? So that's amazing. So.
But, going back to your statistics, you look at it and you realize that exercise is important, not only for cancer, but other areas in your life. And healthy eating, that was another big thing, and proper sleep and rest and so forth. But it took some time. And through the 45 sessions, I thought at the end, I'm done. It's over with. But really that fatigue for me personally lingered for about another 2 years.
Okay.
And, it was something that, I kept going back and say, well, as a man, should I have my testosterone levels checked? And he goes, you're going to come out of this. Your body will come back. For some, it's right away. Others, it just takes a little bit more time. And there was a point in time where we were actually I was going back to him and talking about therapy, testosterone therapy, as an option to see if I could bring that up. And about a month before I was supposed to go in and have all those tests done, it was like everything turned around just like that. You just
started feeling better.
Just started feeling better.
Your body had to heal. We're designed to heal.
Right.
And if you're taking care of yourself and you're giving yourself proper nutrition and you're getting sleep, rest is so huge, and you're resting. And I do a weekly word for winners every week on Kim Martin Motivates. And this week, my word is kind. And it's just about being kind to yourself.
Exactly.
Which I said this morning, listen to your body. You're exhausted. Today's a perfect example for me. I ran the steamboat on Saturday, as we were talking about, and I've decided to ride, which is our cycling program. So I've incorporated a new exercise, riding, and now I'm exhausted. Well, Wednesday mornings are the days that I'm supposed to go longer running, right in the morning. And this morning I'm like, I'm tired. And so I just went for a walk.
There you go.
And I think that's what you're saying. You got to listen to your body.
That's exactly right. And that's what I ended up having to do. I did tone everything down a notch, but there were days I did just go for a walk. Took the dog out, said, running is not today. And, I think that's what just being active and being out, for me mentally is so important, not just for the physical aspect. But I realized that I don't need to go out and ride 90 minutes hard on a bicycle. I can take my bike out and ride around the neighborhood with my wife.
And that's okay.
And that's okay. Yeah.
And I think that's what happens if you're watching and a lot of us are all or nothing.
Right.
Especially athletes, especially people who are a little competitive by nature, right?
Right.
And so it's like, well, if I can't run a half marathon, then forget it. I don't want to run at all. Right?
Exactly. And I just found even the little bits of activity during the day, which I'm sure you talk about with your people, that, morning, going for a 20-minute walk. When you come home at night, another 20-minute walk. Get out during the day and walk for 10 minutes at lunch. I just found that what I had preached to all of my patients and clients before, I was starting to do myself and taking advantage of those smaller blocks of time, lower levels of activity, but just getting out and moving and taking advantage of being outside. I just found so much benefit from that. Overall, I could tone it down and still be happy, still be healthy, fit, and
healthy and fit.
Yeah.
And as we get older, and we are getting older, Blair.
It has been 12 years.
I'm 12 years older
You're
than
12,
when you met me.
Not me.
But you know what, though? You really can get better. Like, when you met me 12 years ago, 4 miles and I could barely make it, and now I've ran 5 marathons in 12 years.
That's great.
So when I ran my first marathon, never in a million years did I ever think I could do that. I'd never been a runner. How many times you hear people say, I'm not a runner? And every time someone says that to me, you know what I say to them? I say, that's because you hadn't started running.
That's true.
You want to be a runner? Start running.
Yeah.
It doesn't matter if you run from, like me, the first time I went out to like the second mailbox on the street before I was about to collapse and gasping for air.
Yeah.
Your body will start to adjust and adapt to what you're doing.
Exactly. And you can start at any age. Given you don't have any, mechanical muscle issues and so forth, running is a possibility at any age. I'm always amazed when you look at these stories of, people in their 70s, 80s, and 90s.
No, it's incredible.
It is incredible. And, as we all age and we're getting up there too, I'm just hoping, yes, I'm still one of those in my 70s,
Me
80s,
too.
and 90s still going.
I keep thinking if I can keep running until I'm 70, I may be able to qualify for Boston.
Yeah,
If I hit the 70-year-old mark, I can qualify at like 4.5 hours or 4 hours and 20 minutes or something like that.
That's true. That's true.
Right now, it's way out of my league. That won't happen. But that's okay. We just keep going. And so your suggestion to people who are exercising, keep exercising if you're diagnosed with cancer or really anything that kind of knocks the legs out from under you for a little bit. Get back up, keep going, do what you can do.
Yeah, exactly. And I think, it goes with cancer, goes with heart disease, pulmonary disease, whatever. You do what you can do. But, the important thing is to keep moving and, get the benefits that you can realize from becoming more active and realize that it's those small bits of times that are just as important. If somebody says you need 30 minutes or 60 minutes, it doesn't all have to be done at once, especially if you're not capable of doing or it looks too daunting at the time. I got to go out and do this for 60 minutes. I can do 10. Okay, that's a great place to start, and if you can do those small blocks of time and you can develop that level of consistency, from week to week to week, you'll start over a period of time to just feel those benefits coming, and you have to be patient.
It takes time.
It's not that quick fix, and that. And that's the hardest part. And if you can start slowly and get them to progress gradually, and work into it based on where they're at. That's the other thing. If you haven't been doing anything for 20 years, it doesn't mean you can't do it. It just means it's going to take maybe a little bit longer, and you have to be a little bit more patient. But you can get there.
Are you back at running now, and
Yeah.
are you back to that kind of level you were before? So
Not quite, but I'm older. I'm 12 years. I'm 12 years old, but I'm back. I'm back out there running, and I'm cycling. Today I got in a swim, got in a couple miles in an hour, so the swimming's back. And
that's the one
I'm
thing I
feeling
got
good.
to add is the swimming. I keep thinking I've got the running, and now I'm doing the cycling, and so the one thing I'm not doing is the swimming yet. And I
have to do I've decided to do a triathlon.
I know. I've been thinking about that, but it's like, I got to swim. And I guess I could learn how to swim in a pool. That's not the big deal, but that open water kind of swimming just makes me. Now, I love the beach, but I like to sit on the side of the shore and tinkle my toes in the water.
It is a little bit different in the open water, but even around the Peoria area now, they have a lot of it. They take the groups out and do some lake swimming and some.
We have amazing resources.
Exactly.
Blair, you are awesome. Thank you so much for giving back. I hope OSF and the employees there, I'm sure they do know how blessed they are to have you leading them and encouraging them and inspiring them.
Oh, thank you so much.
So
I appreciate
hope that I get to have you back on the show because we got a lot to talk about. I don't want our half hour to be over. I just want to keep going.
I appreciate that.
But unfortunately, it's on the countdown now in the last 5 seconds. So, hey, if you've been tuning in and you liked what you heard, show us some love. Like and share. Tell your friends about Healthy You. And I'll look forward to being back with you next Wednesday morning. Thanks, Blair.
Thank you.
All right.
Thank you.
PeoriaLife.com.